Welcome to our channel. Today we are diving into a crucial topic, postpartum depression, often known as PPD. This condition affects many new mothers, bringing immense challenges at a time that should be joyous. For some, traditional treatments do not provide enough relief, which has led many to seek alternative paths. PPD symptoms can range from persistent sadness and worry to irritability and feeling completely overwhelmed. Some mothers might feel constantly wired instead of tired, experiencing intense mood swings. Intrusive thoughts or disturbing images can also be common, making one feel stuck in a thought loop. One mother, Nahia, experienced severe PPD after her first child and felt a strong sense of foreboding before her second was born. She knew she could not endure it again, feeling her body in a constant state of vibration, like pins and needles, irritating and painful. She also felt much guilt and shame. Traditional treatments for PPD usually involve medication or psychotherapy, or a combination of both. Selective serotonin reuptake inhibitors, or SSR, are commonly prescribed. These medications increase serotonin levels in the brain to help regulate mood. However, SSRI can have side effects like weight gain or sexual dysfunction, and finding the right dose can be hard. In 2023, the first oral medication for PPD, zaranolone, was approved, which can ease symptoms in several days. This drug is a synthetic form of the natural neurosteroid allopregnanolone, binding to receptors in the brain that manage mood and stress. Despite these advancements, research shows that up to 50% of PPD cases go undiagnosed due to stigma and women's hesitancy to disclose symptoms. A recent study found only 1 in 2 patients with depressive symptoms receive mental health care in their first year postpartum. This leaves many mothers desperate for answers and help. Some mothers have explored psychedelic mushrooms, specifically psilocybin, as a potential solution. These fungi have a long history of use by indigenous cultures in religious and healing ceremonies. Psilocybin can affect perceptions of reality and potentially alter your sense of self, time, and space. Nahia decided to try psilocybin when her son was 8 months old, drinking tea made from mushrooms. She felt calm, curious, and receptive, going into it with the intention of connecting with her baby. As the psilocybin took effect, she felt weightless and began to see images, including an octopus that seemed to have her baby's eyes. She remembers asking her son to show her what he needed, feeling as if he were taking her on an adventure into the sea, showing her smells, colors, and images of things that made him feel safe and happy. This personal account highlights a profound, positive experience, offering a way to connect and overcome disconnection. Shaylin, another mother, found that antidepressants exacerbated the disconnection she felt postpartum, making her feel numb. She described it as her monster period, very dark, and like putting plastic wrap on fruit, creating a barrier to her emotions. By the time her son was 7 months old, she decided to try microdosing. A microdose is typically 1/5 to 1/20th of a recreational dose, usually subperceptual, meaning it does not produce hallucinogenic effects. While microdosing has grown in popularity, the evidence on whether it has any clear therapeutic benefits is mixed. Experts like Dr. Shatra Rai think psilocybin could be a powerful treatment for postpartum depression, because a hallmark of PPD is the sense of disconnection. Many women say they have lost themselves or feel like an imposter. Studies of psilocybin in people with depression show an enhanced sense of connection. The night Shaylin took her first microdose, she felt present with her baby for the first time. She was filled with gratitude for being able to observe and nurture her son, a feeling that had been completely blocked before. Psilocybin appears to help people feel more even and balanced out, unlike the numbness some experience with SSR. Shalin continued microdosing and trying larger doses, finding that psilocybin helped her to feel love and presence. She noted that being present for the joy also makes you present for the sadness. Scientists are currently exploring exactly how psychedelics may foster feelings of connection and produce antidepressant effects in PPD. They know the body converts psilocybin to psilocin, which activates serotonin receptors throughout the brain and affects communication between brain regions. Specifically, psilocybin can cause disruptions to communication in the cortex and subcortex, leading to more flexible cognition and emotional breakthroughs. A model from Imperial College London suggests psilocybin works by decreasing a cognitive control mechanism called top-down inhibition and enhancing bottom-up processing. These two changes are theorized to make people feel less influenced or constrained by prior beliefs and expectations. This allows them to break their usual thinking patterns and consider new, potentially brighter perspectives. Psilocybin also appears to temporarily desynchronize and reset our default mode network, a group of brain regions involved in introspective thinking, memory, and daydreaming. This network is known to be overactive in people with depression. A study from Washington University found that psilocybin seemed to reduce activity in this network, as well as in the brain area critical for learning, memory, and imagination. This is what can make a trip feel transcendent, causing people to lose their sense of self, time, and space. Interestingly, these brain network changes lasted up to 3 weeks after the psilocybin trip, suggesting psilocybin could make the brain more malleable or plastic, able to grow and connect in different ways. These two essential factors, changes in the default mode network and neuroplasticity, might be responsible for psilocybin's potential antidepressant effects. Pairing the psychedelic with the right type of targeted therapy could establish healthier connections and eventually healthier thoughts and behaviors. This holistic approach emphasizes the importance of integration sessions after the psychedelic experience to process insights. Back in 1970, the U.S. passed the Controlled Substances Act, which outlawed psychedelic drugs and significantly dampened promising early research. Psilocybin is still illegal at the federal level and classified as a Schedule I drug, though its status at the state level is murkier. However, a significant shift is underway. Reunion Neuroscience, a New Jersey-based company, is sponsoring the first ever U.S.-based study on psychedelic treatment for postpartum depression. Previous data on psilocybin's efficacy in treating PPD has been purely anecdotal. This study will use a synthesized psychedelic called RE104, which is very similar to psilocybin but with faster, shorter hallucinogenic effects. Psilocybin trips can last up to 6 hours, while RE104 lasts less than 4. The randomized controlled trial will have 72 participants at 35 sites across the U.S. Participants must have given birth in the past 12 months and not be currently breastfeeding due to concerns about passing substances to babies through breast milk. Results are expected in the second half of 2025. If successful, this will hopefully lead to larger trials in the future. Other promising research includes studies on ketamine for prenatal depression. One low-dose shot of a type of ketamine after childbirth reduced major depressive episodes postpartum by roughly 75% in one study. Some clinics have reported a 90% success rate in improving PPD symptoms with ketamine. Reunion is hoping that its psychedelic drug, RE104, can provide a safe, fast-acting, single-dose therapy that will help patients with mental health disorders, including PPD. The process in this Phase 2 clinical trial is quite straightforward, but its implications are significant. After recruiting participants, Reunion has the women go through 2 preparation sessions with trained facilitators to explain what will happen. The women return a 3rd time for a dosing session in a cozy room, where they are injected with either a single 30 mg dose of RE104 or a subperceptual 5 mg dose for the control group. Within 1 hour, patients will be at a peak hallucinating experience, potentially seeing visuals and shapes. The same two facilitators are there to support them throughout the experience, providing reassurance and comfort. Afterward, participants go through 2 integration sessions to help them make sense of what happened during their trip. Here, facilitators ask open-ended questions, and participants share things they learned about themselves or their past. Their depression symptoms are assessed at days 1, 7, 14, and 28. A potential benefit of using a psychedelic for postpartum depression is to have a rapid effect. Previous psilocybin studies showed a positive effect on depression symptoms in a matter of days. If symptoms can be treated fast, allowing a mom to bond better with her baby, there could be long-term benefits. Psilocybin does come with risks and shortcomings. Very little is known about the concentration of psilocybin in breast milk, so its safety for breastfeeding is unclear. While antidepressants do pass in very small amounts in the breast milk, more research is needed for psychedelics. There has not been much scientific research on psilocybin's effects on the anxiety that doctors often see in PPD patients, though anecdotally, moms report relief. Some respondents in a survey reported physical side effects such as nausea, fatigue, and general anxiety. Several women also said the trips brought up intense emotions that could be overwhelming without the time or professional help to understand what they meant. Another challenge is the concern about judgment from family and friends. Stigma around mothers' use of psychedelics is pervasive. A growing controversy facing researchers is whether talk therapy should always be provided along with psychedelics. Many experts believe the benefits are not solely from the pharmacological properties, but from their combination with psychotherapy, which may enhance neuroplasticity and help change rigid behaviors and thought patterns. However, some argue psychotherapy is not necessary. Dr. Chaitra Hairai believes it is unethical to offer psychedelics without the therapy component, especially in the postpartum period, because psychedelics can be quite intense emotionally. Without that support, they could prove to be more harmful than helpful. It is crucial that women have a support system in place when taking psychedelics to ensure safety, whether that is a therapist or some other sort of guide. In the postpartum period, depression can make people very vulnerable, and we need to make sure that vulnerability is not worsened through a difficult psychedelic experience. Currently, there is no standard for the type of therapy used in psychedelic research. Some trials provide only general guidance sessions, while others offer specific psychotherapies or non-directive counseling where facilitators allow participants to lead the conversation. The general aim is to make them feel safe and comfortable. The Reunion study provides what researchers call psychological support through preparation and integration sessions, but not formal psychotherapy. This is to allow a clear evaluation of what the drug is doing, without cause for confusion or uncertainty from the addition of psychotherapy. Reunion states it is not opposed to therapy. The past few years have been a rocky road for psychedelic treatment approvals, making it unclear if psilocybin will ever get the official nod from the FDA. In 2019, the FDA called psilocybin a breakthrough therapy for major depressive disorder. However, last year, the FDA delivered a shocking blow when it rejected an application for therapy using the psychedelic MDMA to treat people with PTSD. Despite encouraging study results, the FDA said benefits did not outweigh risks and requested more clinical research. The controversy over psychotherapy was a key part of the MDMA decision, as FDA advisors said it was difficult to determine how much the accompanying talk therapy contributed to the results. This decision complicates the path forward for other psychedelics like psilocybin. There are concerns that other drug companies will abandon the talk therapy component of psychedelic treatment to avoid a similar fate. The process is lengthy and expensive, and any postpartum meds have the added hurdle of proving they are safe to take while breastfeeding. Despite these challenges, Reunion Neuroscience is optimistically focused on getting an FDA-approved RE-104 to market by 2029. If approved, women could, in theory, receive it at a specialized treatment center. There is also the possibility that psilocybin will eventually be approved for use in people with general depression, allowing healthcare providers to prescribe it off-label for women with PPD, making it similar to ketamine. As scientific progress may be slow due to psilocybin's complex and not yet well understood impacts, some women are taking matters into their own hands. After having her fourth child in 2023, Nahia entered yet another period of depression as her marriage fell apart. She decided to go back to what had worked in the past: mushrooms. This time, she took a large dose. She saw a lot of imagery of female heroes: Joan of Arc, Cleopatra, Isis, which infused her with a knowing that she could do it, that she had strength. It made her love being a mom. It stopped being a responsibility and started being a role she gets to play happily. It has been almost a year since that experience, and Nahia can still tap into that powerful frame of mind. She approaches challenges with resilience, knowing tomorrow is a new start. Your support helps us continue to produce informative content about vital health topics and emerging treatments. We aim to shed light on complex issues and provide accessible information to our community. Every contribution, no matter the size, makes a difference in our ability to research and share these important stories. Thank you for being a part of our mission to inform and empower.